I'm Susan Biggar. I have my connection to health is that I have three sons, and my two eldest sons have cystic fibrosis. They're 21 and 18. So I've had about over 2 decades of living with illness, and I've thought a lot about and had some experience with working in partnership with clinicians and researchers. And I think for me, one of the things that's very important is this concept of good partnership. I think a true partnership is when is about respect first and foremost, and it's about in many ways it's like a multidisciplinary approach, and one of the disciplines being someone with lived experience of health, and understanding that when we involve the public or patients and families in research, they bring a perspective and a knowledge that other people around the table don't have, and through that they're able to contribute a different way of doing things, different way of thinking about it. So I also think that partnership, it's really essential that if it's going to work, that patients and families are involved from the beginning and are involved in thinking about what is valuable research and how do we do it, and how is it going to be most successful. I think they can offer insights all along the way that often researchers don't necessarily think of. I think one of the things that I've seen in my work is that patients and families bring a reminder of the reality of what people are doing, that that is really helpful, and in some ways can be, I think, inspiring for researchers to remember why this matters. In our family's experience now of over 20 years, I've seen improvements, and I've seen medications and treatments that have come directly from research. And some research, one particular thing I can think of that was Australian research that has absolutely changed the day-to-day routine of my kids and has improved their quality of life. And so I think that's one of the reasons that I work to raise money for research, because I know that my family, like many families, we're in this for the long game, and we believe and we are confident that research will change the way our kids live in the future, and it really matters. It really, really matters. And so I believe in it. And when we raise money for research, also we do that in part in partnership, because we want to bring a patient and family perspective to that research. So raising money is one way that we can have a more significant role in that. I think the days are definitely gone when people raise money and just hand it over without any questions. It's much more about how are you going to use this, and it's trust and it's respect, because we do trust and respect the researchers we work with, but we also know that it's helpful for us to have that relationship all the way through. I think, I guess, one of the things for me that I've also seen, one of the inputs that patients and families can bring, is that they can add in some reality about what is realistically going to work and what's not. I can think of a study that we were involved in a number of years ago, and it required my kids to do nebulizers 4 times a day. And I had 2 kids on the study, and it pretty much wrecked our lives for 2 or 3 months, until we said, even if this gets approved, it's never going to work for people who are healthy and trying to live their lives still. And I think that kind of input probably would have been useful at the very beginning, to think about because people want their health, need their health, but they don't want their health to rule their lives. They want their health and good health and staying healthy to be something that's sustainable over the long haul, and it's realistic. So I feel incredibly positive about research. I absolutely believe that, certainly in our community for cystic fibrosis, that research is changing the way people live today and the way people live in the future. And I'm, like many patients and families, incredibly grateful for researchers who sort of slog away every day in their labs, and appreciate the opportunity to tell them that what they're doing is really making a difference. So thanks.
Thanks for listening to Susan's story. If you would like more information about Monash Partners or about Susan and the work she does, please contact Gillian Chamberlain on 03 8752 2627 or at gillian.chamberlain@monash.edu. and that's Gillian with a G. Thank you.